Hello guys, welcome to Medycoding.com. So in this lecture, we are going to study the anatomy of the urinary system. So the first organ is kidney. After the kidney, we will study ureter, then we will study bladder, urethra. So I will give the information that is essential for medical coder. I will not go in depth. I will give the limited information. But if you want to get complete information, you can go by your own. So let's start it. What is system? So you know that cell is the basic unit of your body. So many cells combined to form it a tissue. And so many tissue combined to form an organ. So many organs perform a particular function. Then we can call it as a system. So this is same as the urinary system. It is also a system. So in urinary system, it is also known as the renal system. So all the organ, kidney, ureter, bladder and urethra collectively work together to perform filtration of the blood and excrete it outside of the body. So this is known as urinary system. The first is kidney, then ureter, then bladder, then urethra. So in this lecture, we're going to study the anatomy of kidney only. So what is the function of the kidney? The main function of kidney is filtration and regulation. So the kidney remove the waste, urea, that is byproduct of protein metabolism, then creatinine, that is waste of the metabolism of muscle. The next is balance of electrolyte, like sodium, potassium, calcium, and water. So now we know the function of the kidney. Next is, what is the position of kidney? This is very important. The position of kidney, it is a retroperitoneal organ. So retro means behind. Peritoneum is the lining of the abdomen. So kidney is found behind the peritoneum. Also, the next, it is found in the posterior abdominal wall. So it is found on the posterior side, not on the anterior side. So it is easy to go from the posterior during surgery to access kidney. What is the shape of the kidney? The kidney is in the bean shape. As you can see, it is in the bean shape. So the upper portion is known as the pole. This is a pole. The upper pole is broad. Yes, the gland you can see here. This gland is known as suprarenal gland, also known as adrenal gland, and the lower pole is pointed. So this is the position of the kidney. So you can see here the upper pole is closer and the lower pole is farther. It is because the kidney is inclined at a particular angle. So this is a psoas major muscles. You can see here. This muscle is going parallel to kidney. For as a surgery coder, you should know the surrounding structure of that particular organ. It will help you visualizing the surgery procedure. So what is the relation of the kidney with respect to different organs? So as compared to vertebral level, we can see that kidney position is extended from T12 to L3. So in this figure, this level is T12 to L3. So in this area, the kidney is found T12 to L3. So the next is that right kidney is slightly lower as compared to left. The right kidney is slightly lower because of the liver. You can see here the posterior relation and the anterior relation. As for anterior relation, there are so many organs as there like duodenum, stomach and spleen. In the posterior, the ribs 11 and ribs 12 is found, that is also known as the floating ribs. Floating ribs means the ribs that is not attached to sternum bone. So we will see skeleton system in detail in upcoming lectures. So these are the relation of the kidney with respect to different organ. The next is very important, that it is the covering of the kidney. So the first covering of kidney is the fibrous capsule, means the layer just after the kidney that is enclosing the kidney, that is known as the fibrous capsule. Okay? After the fibrous capsule, the layer that is perinephric fat. So this perinephric fat is made of adipose tissue surrounding the capsule. So this area is known as the hilum area that we'll see on next slide. First two layer, perinephric fat and the fibrous capsule, both are enclosing the hilum area. The next is the renal fascia. This is very important. This is also known as Gerota fascia. So this is also a covering. Three covering we have already seen: fibrous capsule, perinephric fat, renal fascia. So renal fascia covering is enclosing the adrenal gland. Okay? The first two covering is not enclosing the adrenal gland, but this renal fascia covering is enclosing the adrenal gland. The last one is paranephric fat. So as the name you can see, para, it means beyond. So beyond the kidney, outer most layer is known as paranephric fat. Perinephric means surrounding. The function of paranephric fat is to provide the cushion. So these are the covering of the kidney that is very important, because for radical nephrectomy, the physician removed the adrenal gland plus Gerota fascia. So this is the other view of the layer of the kidney that we already seen. So now let's start with the detailing of the inner structure of the kidney. First of all, we should know what is hilum. Renal hilum is very important location in the kidney. As you can see here, this concave area, this is on the medial side of the kidney. This concave area is known as hilum. So many structure go through this area, like renal vein, renal artery, renal pelvic. So the space inside the renal hilum is known as the renal sinus. So if you can see is this slide, the location of different structure that is going to the hilum. VAP means vein, artery and pelvis. This is position of structure going to hilum from interior to the posterior. Now we are going to study the internal structure of the kidney. So you can see here that this is a fibrous capsule that we already studied. This is the renal cortex, that is the inner part of the kidney. Then renal medulla, okay. Then renal pyramid, then the renal papilla. This structure is known as the calyx. Okay, so we will study this in a detail. Let's start with the renal cortex. So renal cortex is the granular layer just under the capsule. This is the region where the blood is filtered. It means the main filtering unit of the kidney is found in the renal cortex. The renal cortex contains nephron, and the nephron is also known as a functional unit of the kidney. So this is very important for any fresher medical coder, for CPC or for any interview of the medical coding. So don't forget that nephron is the functional unit of the kidney. So it contains renal corpuscle and renal tubules that complete the function of the filtration of the blood. After the renal cortex, the next is renal medulla. So renal medulla is the inner part of the kidney and it contains pyramid, the renal pyramid. The base part of the renal pyramid is facing towards the cortex, and the lower part, that is apex, this area is known as renal papilla. So in this slide, you can see here the renal papilla. Okay, there is small opening here. We know that the renal cortex is filtering the blood. After it is going down to the end of the renal apex, the small opening is there. So that small opening is known as ducts of Bellini. So the renal papilla contain this duct to drain the urine. Through this duct into the next part. The next part is calyx. Okay, so the renal papilla drain all the urine that is collected here through the small opening called as ducts of Bellini. Moving to the minor calyx. The minor calyx are the cup-shaped structures that collect the urine, okay? Then the next part is major calyx. So many minor calyx combine together to form a bigger space for the urine, that is major calyx. Okay, so the minor calyx and major calyx are the structure that is collecting the urine. After this structure, the funnel-shaped structure, there is another structure that is collecting the urine. That is known as renal pelvis. Since minor calyx, major calyx, and renal pelvis are collecting urine, so this all collectively called as renal collecting system. Renal pelvis. Renal pelvis. This is very important because you will see this term so many times in your ICD, especially for the stone. So the renal pelvis is the funnel shape area, okay? So this is the expansion of the ureter. It means ureter on upper side get dilated and it become renal pelvis that sits within the kidney. The next part organ is ureter. Will we study the anatomy of ureters later after this lecture? This one location that is known as ureteropelvic junction, where the ureter and the renal pelvis meet. So we study about the kidney in this lecture. I hope this video is helping you and you'll get more output from this. If you the PDF for this, visit on www.medycoding.com or you can click directly on the link on this video description. Give me your suggestion if you have any. Okay, thank you. If you are watching this video in YouTube, then must visit website medycoding.com, the best place to learn medical coding. Because in website, you will get more anatomy videos. The same topic video that you are watching now will be updated after some time with more clear explanation.